All right. A child, have you heard about this? A child in New York was diagnosed with monkeypox, a child. And now there's growing concern about the spread of the virus.
Yeah, just in time for schools to start. For more, let's bring in internist at Northwell Health, Dr. Frank Contessessa. Dr. Frank, welcome back. So let's talk about this. The CDC says more studies are needed to establish if this can spread, how this infection can spread. But in this study, about 70% of common household objects tested positive for monkeypox in a household, shared by 2 monkeypox patients. Talk to us about this.
Sure. Good morning, Allison. Thanks for having me back. So let's be clear about what they specifically found. So they found PCR positivity. That means fragments of the virus.
Right.
They did not find active viral cultures. That means if you touch those surfaces, you probably couldn't get sick from that. It was just a fragment. The same way that the PCR test for COVID was very sensitive. Even if it was weeks after you had COVID, you could still test positive because you're testing for viral fragments, not for the virus itself. So the surfaces that came up positive probably couldn't make you sick, and that's good news.
Yeah, so the immune system basically is able to fight off limited small exposure. Is that what you're saying?
Well, that's correct, Rob. But what you're exposed to with these fragments is just a little piece of the virus. It's not the entire virus. It's not enough to make you sick.
Okay. Let's go through this case in New York. This is the first case of monkeypox in a minor. The CDC says that vaccines are being made available for children as well. What do you make of that? Is that necessary? Are we going to see parents rushing before the school year starts to get their kid vaxxed for monkeypox?
Well, no, I don't think we're going to be seeing that, Rob. So with monkeypox, let's be clear about how it's spread. This minor almost certainly got monkeypox from a household contact, not from being out in the environment, not from being out in camp or in school,
right?
Probably from somebody who had it at home. And this is still by and large in a very narrow band of the community. So, no, I don't think we're going to be seeing a rush of parents to vaccinate their child for monkeypox before school starts. And I certainly don't think we need to.
Yeah. Doctor, I want to ask you about, Rob mentioned it earlier, as your immune system. Are we going to see more people become sick because our immune system is perhaps weakened after wearing masks for almost 2 years and staying inside, especially young kids, because that's how they build up their immune system, right, is getting a lot of these colds and sicknesses? Sure.
You know, Alice and I had that same thought for the almost entire full year that I wore an N95 mask with every patient. You know, as a physician, I'm in contact with sick people almost every day of the year. And thankfully, I get sick not very often. It's like the kindergarten teachers. You get sick for the first year that you are teaching kids, and then you're immune to everything. You've been exposed to everything. You know, I think it's been long enough, and I think people are not wearing masks as much anymore. So I think we'll be okay. The immune system is pretty resilient, and there is what's called immune memory. So the short period of time that we've been wearing masks, no, I don't think it's going to make a huge impact. No.
Yeah, I did see somebody on a kayak over the weekend with a mask on. I'm totally serious. And I wanted to swim out and say, why?
Or
why are you wearing this right now? Tell me. Even if you have COVID, you're alone on this kayak. Not on tandem. Yeah, it was so bizarre. Just back to monkeypox, Dr. Frank, for a moment. So the log cabin Republicans last week basically say that Joe Biden has abandoned the gay community with his response to monkeypox, making the comparison to Ronald Reagan and AIDS in the early 1980s. Then the Washington Post wrote an article about it, saying inside America's monkeypox crisis, the mistakes that are making it worse. Does the administration need to do more to sort of streamline not just the messaging, but also the response to this thing?
I think they certainly can. It's an opportunity here. You know, this is the early stages of this outbreak. And I think we kind of missed the boat with COVID on this because it's in such a narrow band of the population and it's so easily targeted. I think it's a great opportunity for the government and for the White House to target the vaccination effort and the treatment towards this particular community. So I think there are similarities here, and I think it's a great opportunity for them to act early and to limit this at the earliest stages.
And they want to change the name. The World Health Organization says we got to change the name.
Well, let's focus on what's important. I don't think the name is really that important.
Right, exactly. Yeah. Spend time with other things. All right, Dr. Frank Contessessa, thank you so much. Always great to have you.
Thank you, guys.
Of course.